Hello, this is Dr. Meyer with our weekly video blog. This week I'd like to talk to you about sleep apnea. This is a very common problem, particularly in a pulmonary practice like I have, and I can usually ask patients and note their snorers. It's a very common symptom of sleep apnea, and when I look in their throat is very narrow. And so I just ask them, do you snore? And sometimes if they're living alone, they may not know. But if they have a bed partner, they can say, oh, a bed partner or a wife or a spouse moved out of the bedroom. Oh, I snored so loud. And so they're in the other room. The point of this is getting things done before the first office visit. Now, most of the publicity on the web and elsewhere is, if you snore, see a doctor. But there's certain things you can do before you see the doctor. Don't waste the first office call on just getting particulars and figuring out what you need to do. The patient with sleep apnea will have loud snoring and then all at once become very silent. And this is when the sleeping partner has to wake up, look at the person that's breathing, and see if his chest moves. And so if a person is breathing, the chest moves with the breathing, and then all at once the snoring stops, but the chest is still moving, he's obstructed. So he's obstructed in his throat, and that's where obstructive sleep snoring is. The chest is still going, but there's no air movement, and so he has obstructive sleep apnea. He's not breathing, but his chest is still going in and out, and he's trying to breathe, but he's obstructed. And then he probably will break loose after a minute or so, and then all at once you'll hear big loud stridor. And then all at once your bed partner is breathing again. So you basically have made the diagnosis of obstructive sleep apnea before you even go to the doctor. Then you can talk intelligently about this and all the other symptoms that you'll have that goes with it. People have obstructive sleep apnea. They're tired during the day. They go to sleep. They almost like narcolepsy. They go sleep in the upright position. They go sleep after they eat. They can go to sleep between conversations. They go sleep while driving a car. And so they have significant problems in staying awake during the course of a day. And they're always tired. They never feel rested. And so then when you go to the doctor, you can mention all these symptoms, and the diagnosis is clinched before you do that $1,500 or $3,000 sleep study. Now, you still will need that if we're going to treat that, and the treatment of that is fairly simple nowadays. The old days, we ear, nose, and throat surgeons would ream out the throat a bit, and so it wouldn't be obstructed so much. But if they reamed out too much, then when you swallow water or milk, it would come out through your nose, and that's a significant side effect. And then there's that's called a palatoectomy. They cut out part of the palate, and the uvula is gone. And then the sonogram, where they put sound waves there just to track it up a bit, that was very popular for a while, and some of the chest physicians in this community were doing that for a while, and that's kind of fallen by the wayside. The long accepted treatment is what we call CPAP, continuous positive airway pressure. So then you wear a mask over your mouth and nose, or maybe they have small ones now just fit over your nose and gives positive pressure. If there's positive pressure, then the throat isn't going to collapse, and therefore it keeps it open and you can breathe all night. There's certain side effects as far as tolerating the mask all night. Some people can't get past them. More people can get past now that we have the nasal CPAP and the mouth is open. And it's also the noise of the machine that's pumping the air and giving the back pressure, so it's never no back pressure, so there's always a resistance to exhaling. And so there's problems in accepting that. I have many patients that just never could do that. But I also have many patients that think this is the greatest thing that's ever happened to them medically. I have one person who had sleep apnea, obstructive sleep apnea. There's other kinds of sleep apnea. Obstructive sleep apnea since his 30s, and he was a big Boy Scout trooper, and he took his troop on overnight hiking and camping. And he took this machine on a battery, and he had a great time with his boys going on Boy Scout camping trips. And he would wear this all night long, and he felt rested like he's never felt rested before. So that's it for this week on obstructive sleep apnea. We'll be back with you next week with a new topic.